A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a significant shakeup within the U.S. public health landscape, all members of the Advisory Committee for Immunization Practices, ACIP, have been removed by Health and Human Services Secretary Robert F. Kennedy Jr. This decision, announced on June 9th, has raised eyebrows and ignited a fierce debate over vaccine policy and public health governance. The ACIP, which has been a cornerstone of vaccine recommendations since its establishment in 1964, has seen its 17 members dismissed, all of whom were appointed during the Biden administration. 11 of these members were expected to serve until 2027 or 2028, making this a sweeping change that some critics are calling unprecedented. Kennedy's administration claims that the previous appointments were an attempt to lock in public health ideology and limit the new administration's ability to restore trust in vaccines. In a statement, Kennedy emphasized the need for a clean sweep to reestablish confidence in vaccine science. He expressed his intention to appoint new members who will prioritize public health and evidence-based medicine, distancing the committee from what he described as rubber stamp practices that have benefited industry profits. The abrupt termination of these committee members has not gone without backlash. Dr. Bruce Scott, president of the American Medical Association, voiced concerns that this action undermines the trust that the ACIP has built over generations, stating that the committee has been a reliable source of guidance for healthcare professionals and the public alike. The American Academy of Pediatrics echoed this sentiment, suggesting that the move is part of a broader effort to silence independent medical expertise and foster distrust in life-saving vaccines. The ACP plays a crucial role in advising the Centers for Disease Control and Prevention, CDC, on vaccine use, including recommendations for immunization schedules that impact federal policies and insurance coverage. The committee's decisions are closely monitored by experts and health authorities, making its integrity paramount. Kennedy's assertion that the ACIP has been plagued by conflicts of interest has been met with skepticism. Critics point out that while committee members are prohibited from having financial ties to pharmaceutical companies, Kennedy himself has a history of litigation against vaccine manufacturers, raising questions about his impartiality. As the public health community grapples with this upheaval, the CDC is scheduled to meet from June 25th to 27th to discuss COVID-19 vaccines and other topics. The committee's recent discussions have indicated a potential shift in vaccine recommendations, moving away from a universal recommendation for COVID-19 vaccines to a more targeted approach based on age and health status. This change comes on the heels of Kennedy's directive to update immunization schedules, which has removed previous recommendations for pregnant women and altered guidance for children regarding COVID-19 vaccinations. The implications of these changes are significant, as they could affect vaccine uptake and public perception of vaccines. As the situation unfolds, many are left wondering who will fill the vacancies left by the dismissed committee members and whether these new appointments will restore confidence in the vaccine approval process. The controversy surrounding Kennedy's actions highlights the ongoing tensions in public health policy and the delicate balance between political influence and scientific integrity. With the future of vaccine recommendations at stake, the coming weeks will be crucial in determining the direction of U.S. public health initiatives and the trust placed in them by the American public. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.